1. CDC ends H5N1 Avian Flu Emergency Response. What you need to know. 2. CDC ends bird flu emergency. What this means for public health in 2025. 3. U.S. bird flu emergency response ends. What happened? 4. CDC ends H5N1 bird flu emergency. What you need to know in 2025. 1. CDC ends H5N1 avian flu emergency response. What you need to know. The CDC's shift in response to H5N1 avian flu. What you need to know. The Centers for Disease Control and Prevention, CDC, has officially concluded its emergency response to the H5N1 avian influenza outbreak. This decision marks a significant transition in how health authorities are managing this particular strain of bird flu. A representative from the Department of Health and Human Services, HHS, announced that the emergency measures were deactivated to transition back to regular program activity as of last Wednesday. This change comes in light of a noticeable decrease in reported animal infections and the absence of any human cases since February. The spokesperson emphasized that while the emergency response has ended, the CDC will maintain its vigilance. Surveillance, readiness, and response for influenza, including H5N1 bird flu cases, will continue under the purview of CDC's Influenza Division and other appropriate agency programs, they stated. This indicates that the CDC is not entirely stepping back but rather shifting its focus to routine monitoring and preparedness. The emergency response to H5N1 was initiated in April 2024, and during this period, the CDC documented 70 human cases of the virus. Importantly, there have been no instances of human-to-human transmission reported. Tragically, one individual, a man from Louisiana, succumbed to the disease earlier this year after being hospitalized with a severe form of the illness. Health officials believe he contracted the virus from a backyard flock of birds. Currently, the risk posed by H5N1 bird flu is considered low, but the CDC has assured the public that it will continue to monitor the situation closely and scale up activities as needed. This proactive approach is crucial, especially since more than a dozen states have reported cases of H5N1 avian flu, with the majority concentrated along the West Coast, particularly in Washington and California. But here's where it gets controversial. As we move forward, how should we balance the need for vigilance against potential outbreaks with the desire to return to normalcy? Are we doing enough to prepare for future health threats, or are we becoming complacent? We invite you to share your thoughts in the comments below. Do you agree with the CDC's decision to end the emergency response, or do you think more should be done? Your perspective is valuable in this ongoing conversation about public health and safety. 2. CDC ends bird flu emergency. What this means for public health in 2025? Here's the shocking truth. The U.S. Centers for Disease Control and Prevention, CDC, has officially closed its emergency operations for the H5N1 bird flu outbreak, marking a major shift in how the nation addresses this ongoing public health concern. But here's where it gets controversial. While officials cite declining animal infections and no human cases since February as reasons for the move, experts are still warning that the virus's potential to evolve remains a ticking time bomb. Let's break down what this means for you, your community, and the broader fight against infectious diseases. The CDC's decision to deactivate its emergency response on July 2 came after a year of intense monitoring, during which the virus infected 70 people, mostly farm workers, and claimed one life. Though the current risk to the general public is deemed low, the agency has shifted its focus to routine influenza surveillance, merging bird flu updates with seasonal flu reports. This means monthly summaries of human cases will replace the previous detailed tracking of animal infections, a change that could simplify data access but also raise questions about transparency. But this isn't just about numbers. The CDC's move follows a year of turbulence, including a significant staff shortage at the U.S. Department of Agriculture, part of broader federal workforce reductions, and the cancellation of a $700 million contract with Moderna for a human bird flu vaccine. These disruptions highlight the challenges of maintaining preparedness amid political and logistical hurdles. Yet, the agency insists it will scale up activities as needed if the situation changes. Here's the part most people miss. While the emergency response is over, the virus isn't gone. Scientists caution that H5N1 spread among cattle and poultry could still lead to mutations that make it more contagious to humans. So, is ending the emergency response a sign of confidence, or a risky gamble? Share your thoughts below. Do you think the CDC made the right call, or is this a step too soon? The conversation matters, and your voice could shape the next chapter of this story. 3. U.S. bird flu emergency response ends. What happened? The U.S. just made a controversial pandemic decision. Here's what you need to know. As egg prices stabilize and infection rates plummet, American health authorities have quietly ended emergency measures against one of the most disruptive animal disease outbreaks in recent memory. But here's where it gets tricky. While the CDC's move signals returning normalcy, some experts warn we might be lowering our guard too soon. The Centers for Disease Control and Prevention, CDC, officially concluded its avian influenza emergency response last week, according to insider sources speaking anonymously to Bloomberg. This decision comes nearly 18 months after the H5N1 virus strain triggered a perfect storm of human infections, dairy cattle outbreaks, and the worst poultry supply crisis since the 2015 bird flu epidemic. Let's break this down simply. When a public health emergency gets declared, it's like putting the government's response team on red alert. This status allows faster funding allocation, emergency vaccine development, and special protections for healthcare workers. The phase-out indicates that 1. Human infection rates have dropped below critical thresholds. 2. The virus shows reduced transmission capability. 3. Agricultural sectors, particularly poultry and dairy, have contained outbreaks. But here's the twist most media isn't discussing. While emergency protocols sunset, enhanced surveillance continues through 2026. This isn't mission accomplished, it's mission adjusted, explains Dr. Sarah Whitman, a veterinary epidemiologist we consulted. The real test will come during next year's migratory bird season. Controversy alert: critics argue this decision prioritizes economic recovery over pandemic preparedness. After all, H5N1 still maintains a terrifying 53% mortality rate in humans according to WHO data. Are we repeating the same complacency mistakes made during early COVID phases? Or is this a responsible transition to long-term management? Food for thought: during the peak crisis, egg prices soared 138% as farms culled over 58 million birds. Now imagine this scenario with a virus that's both deadly to humans and highly contagious in animals. Could better poultry vaccination programs have prevented this economic shock? The debate rages on. We want to hear from you. Do you think lifting emergency status is premature given H5N1's pandemic potential? Could this decision impact consumer confidence in poultry products? Share your perspective in the comments. Let's discuss what normal should look like in post-pandemic America. 4. CDC ends H5N1 bird flu emergency. What you need to know in 2025. A significant development in the world of public health has just been announced. The U.S. Centers for Disease Control and Prevention, CDC, has officially ended its emergency response to the H5N1 bird flu. This decision, though seemingly straightforward, is a fascinating glimpse into the complex world of disease management and the delicate balance between preparedness and resource allocation. The CDC's move comes as a result of a notable decline in reported cases of the bird flu. In fact, no human cases have been reported since February 2025. This decrease in infections has led to a shift in strategy, with the CDC transitioning back to regular program activities. But here's where it gets controversial. Some might argue that this decision is premature. After all, the H5N1 virus has caused sporadic outbreaks worldwide since the late 1990s. Since 2022, it has affected nearly 175 million birds in the U.S. alone, including wild birds and commercial flocks. The virus has also spread to dozens of mammal species in over 100 countries, posing a significant threat to animal health and, by extension, human health. In early 2024, the virus even infected dairy cattle in the U.S., threatening the dairy industry. Over the next 14 months, it spread to over 1,000 herds across 17 states. This rapid spread highlights the potential for a serious outbreak, which could have devastating consequences for both animal and human populations. Despite these concerns, the CDC's decision to end the emergency response has been supported by Dr. Nirav Shah, a former principal deputy director of the CDC. Shah emphasizes that the decision was made by career scientists at the CDC, based on the rationale that there have been no human cases for some time. He suggests that the response can be easily ramped up again if needed, and that the current level of intensity is not necessary when there is a low risk of human infection. The CDC's H5N1 emergency was declared on April 4, 2024, and provided additional support to the public health response, including increased staffing. However, with cases slowing down and no new human infections, the CDC has decided to deactivate this emergency response. And this is the part most people miss. While cases have slowed, experts note that bird flu has a seasonal pattern, with cases typically peaking in the fall or early winter. Changes at federal health agencies might mean that some milder cases are going undetected, but serious cases are unlikely to be missed. The current public health risk from H5N1 bird flu is considered low, but the CDC will continue to monitor the situation closely and scale up activities if necessary. This ongoing vigilance is crucial to ensure that any potential outbreaks are quickly identified and managed. So, while the CDC's decision to end the emergency response to H5N1 bird flu might seem like a straightforward step, it's a complex issue that highlights the challenges of managing public health risks. It's a delicate balance between being prepared for the worst while also ensuring that resources are allocated efficiently. What do you think? Is the CDC's decision a wise move, or is it a risky strategy? Share your thoughts in the comments and let's discuss this fascinating aspect of public health management.